Good morning. I'm Dr. N Reddy. I'm the chairman of Continental Hospitals here in Hyderabad. Continental Hospitals is a tertiary and a quaternary care health facility that was built in the year 2010 after my stay in the United States of America for almost 3 decades. The hospital today has more than 50 specialties catering to the local communities, the regional communities, and people across India and several international patients. Continental Hospital is deemed to be one of the largest hospitals in the country with a bed size of about 800 and currently with 500 plus beds which are in operation. We are proud to have at this hospital a wonderful ancillary support system that includes our nurses, our physician assistants, our DNB students, our registrars, and various other ancillary support staff who contribute to our successes every day. I'm glad to welcome the Indian Association of Physician Assistants for their annual convention. This is an amazing body that was constituted in the year 1998 and every year engages this annual event to inspire, to welcome, to facilitate learnings of physician assistants all across India. The significant credit goes to the president, Mr. Shiv Kumar, who has done an amazing job over the last 10 to 15 years, whose multiple representations to the government of India has eventually succeeded in licensing the physician assistant program in our country. I was engaged for a few years actively in this association because I come from a country where physician assistants are given some of the highest credence. In the United States of America, there are close to 200,000 physician assistants today who play a very vital role in various functions of healthcare. Their body is just growing at this point in time. As far as India goes, when Continental Hospital was established in the year 2010, I was one of the instrumental physician champions of PAs in our country. Although there was a significant dearth of physician assistants, there was very few states for training and producing the physician assistants. We have to use nurses or those of them who have done programs just for a year, calling them as clinical assistants and to help doctors and help in various departments across the organization. But today we have close to 40 or 40 plus properly trained physician assistants who are helping medical physicians, who are helping super specialty physicians, who are helping our surgeons, who are in different areas and activities like intensive care units or laboratory diagnostics in radiology and various other fields of the hospital. We have a continual training program at Continental Hospitals, and we have physician coordinator, and they engage in various educational activities that includes their weekly medical grand rounds where the entire team participates. Our physician assistants have been empowered to triage patients, to enter all the information into our sophisticated electronic medical record, which is a repository of the patient's care, to advise patients with regards to their medications, the various diagnostic tests that are arranged, to explain certain basic results of the patient, typically blood test results, simple radiologic results, and make the journey easier. As a matter of fact, a physician assistant is a de facto physician leader who, after years of training, builds up trust with the patients that is engaged to see, builds up confidence with the patients, and in turn I have seen patients developing enormous stress where often we see them asking for a physician assistant than the doctor. That's the greatest tribute that we can pay to a PA when he earns the confidence and trust of the patient, and patients do not miss at times the doctor not being present. I request all the PAs who are attending this conference to deem it their privilege to be a part of this association to be part of the healthcare consortium of providers, to work hard to improve their clinical and cognitive skills continuously, and to bridge the huge gap that prevails today in the Indian healthcare system in terms of adequate number of providers, in terms of adequate number of counselors, patient counselors, and in terms of adequate number of providers in properly taking care of patients, guiding and navigating them without creating much of confusion and chaos. You're all welcome to come to Continental Hospitals and study how our PA system operates here. And you're all welcome to, if you're moving to Hyderabad, to seek out to Continental Hospitals and have an opportunity to work here. It is very important also how physician assistants are compensated. It's important to take care of them with proper salaries, incentives, because we know that PA salaries vary anywhere from 1.5 to 2 lakhs to 6 to 7 lakhs or 8 lakhs, per annum. I think if these assistants are paid well, commensurate to their experience, they will and continue to prove to be an incredible asset. I congratulate once again the IAPA Association on this year's organization, and I'm glad to step forward another year to provide the merit scholarships on behalf of Continental Hospitals. Wish you all great luck, a wonderful event, enjoy, and look forward to you all rising up in the organization and become tomorrow's leaders. Thank you.